Hello, my name is Cindy Snyder, and I'm the Advanced Clinical Genomics Nurse Practitioner with Georgia Core. And I'm happy to be here with you today to talk about hereditary breast cancer. So our objectives for today are to determine the level of knowledge regarding hereditary breast and ovarian cancer and identification of women at risk. We also are going to learn how to identify patients at risk for hereditary breast and ovarian cancer through their family history and recognize the need for hereditary breast and ovarian cancer screening as recommended by the U.S. Preventative Services Task Force. And finally, I want to increase your knowledge in the use of our screening tool at the breastcancergenescreen.org website. Hereditary breast and ovarian cancer syndrome is an inherited tendency to develop breast and ovarian cancer at a young age. Other cancers associated with hereditary breast and ovarian cancer, or HBOC, are fallopian tube, primary peritoneal, prostate, pancreatic, and ocular melanoma. There was some early evidence that there may be an increased risk for colon cancer, but this has not been confirmed in the literature. The majority of cases are due to a mutation in either the BRCA1 or BRCA2 genes. But now our testing strategy includes panel testing because there are many other genes associated with hereditary breast and ovarian cancer. So we now do a panel gene testing strategy. The Commission on Cancer Standard 2.3 defines a person trained in genetics or a professional trained in genetics as somebody who can help an individual or family understand their genetic test results. And these people include advanced practice nurses in genetics as well as genetic counselors. So among the general population of people, it's about a 1 in 400 chance that they carry a BRCA mutation. With women with breast cancer at any age, it's about 1 in 50. Women with breast cancer at a younger age, younger than 40, it's about 1 in 10. Men with breast cancer, the incidence is about 1 in 20. Women with ovarian cancer at any age, the incidence ranges from 1 in 8 to 1 in 10. And people of Ashkenazi Jewish ancestry, it's about 1 in 40. And that's because of the founder mutation effect within that population of people. I want to talk about family history because family history actually is one of the most informative genetic tests we have. And knowing the family history is a way for clients to be proactive about their health and lower their risk for cancer and disease. And it can give you a lot of information about your client's risk for cancer and other disease. It's important to know the family history from both sides of the family, the mother and the father side of the family. We not only share biology with other family members, but we may also share environments and behaviors that can impact our health. So the diagrams you see here are examples of families, and we use diagrams like this to create a picture of a family history. In these diagrams, circles represent females and squares represent males. So based on the family history, your client may need to be screened for a type of cancer at an earlier age, or may need to have more frequent screenings. So for example, women at average risk for breast cancer need to start screening at age 40. But if there is a hereditary cancer risk, that person may need to start screening for breast cancer in their 20s. So with the holidays coming, this would be a great time to talk with family members and update the family history. Sometimes, though, you and I both know that family members don't want to talk about things and they'd rather keep it to themselves. So it can make it tough for people to get information, and it may take more than one conversation. But it is important for all family members to be aware of their family health history. So Some information you should ask and why is, first of all, types of cancer in the family. And you want to get the specific type of cancer if you can. Oftentimes you'll hear people say it was bone cancer. Well, was it really bone cancer or was it breast cancer that spread to the bone? You might hear them say, my aunt had a, quote, female cancer. Well, what does that really mean? That could be cervical, but it could be uterine, it could be ovarian, and it could be even colon, because there's a lot of parts in women below the waist. So knowing exactly what type of cancer is important. The age at diagnosis and the age at death is very helpful. Again, most cancer is diagnosed after the age of 50. And if there are many family members with cancer at an early age, this could indicate an inherited risk. If family members had more than one type of cancer, so multiple cancers in one person, could be a red flag for a hereditary risk. Tips for talking to family. Sometimes it's helpful to, tell patients or clients, find the family historian. Usually there's one or two people in the family that know the information. Ask about first, second, and third degree relatives. First degree relatives are parents, siblings, and children. Second degree relatives are grandparents, aunts, and uncles. Third degree relatives are great-grandparents and cousins. You want your patient to talk to as many people in the family as they can. The more information they get, the clearer the picture becomes. Explain, let them know to explain why you need the information. You're not trying to be nosy, but you're trying to get the information for you and your client to come up with the best plan for screening and early detection. And one final hint is you can use family memories to help people to remember what they may have done to help a sick relative. So let's talk a little bit about the role of genetics in cancer. Human beings have about 20,000 genes in total. It's important to remember that we get half our genes from our mother and half our genes from our father. Genes, real simple, are like a recipe in a cookbook, and this is something you can do to help clients understand what genes are. The chromosome is like the cookbook where the gene is located. So the chromosome is like the cookbook, and the gene is the recipe in the cookbook. They make something, and that's the real simple way of looking at it. So when we talk about hereditary cancer, remember you can inherit a bad copy of a gene from your mother or your father. So you want to know the family history from both sides, not just the mother's side of the family. Now, all cancer is genetic, but not all cancer is hereditary. All cancer results from genetic changes in cells, but not all cancer is because of a bad copy of a gene getting passed on in a family. As best we know, it's only about 5 to 10% of the time where cancer is caused by a mutation in a gene getting passed on in the family. So most cancer is not associated with an inherited gene, it's acquired. And how do we acquire cancer? Well, there are multiple factors, not just one thing. If it were just one thing and one thing only that caused cancer, we would have most likely fixed that a long time ago. So it's like a puzzle with many pieces that come together. As we age, our risk for cancer goes up. Our gender impacts our risk. Women have a higher risk for breast cancer than men. Family history impacts our risk. Our environmental exposure, in fact, impacts our risk. Hormonal factors impact our risk. Our general health and our general genetic makeup. And there are actually other pieces of the puzzle that we still don't even know. So let's talk about the red flags for hereditary breast and ovarian cancer that you need to be aware of when you're looking at this family history. One is breast cancer before age 50. If you see people being diagnosed with breast cancer under the age of 50, that's a potential red flag. Also, ovarian, any of these cancers at a young age, and ovarian cancer at any age. But if you see breast, ovarian, colon, uterine, pancreatic, advanced prostate cancer under the age of 50, there could be a hereditary cancer risk. Multiple cancers in the same person. So a woman with breast and ovarian, a man with prostate and colon. Bilateral breast cancer could be a red flag. Also, along those lines of multiple cancers in the same person, if you have multiple family members on the same side of the family with the same cancer. So if you have grandmother, mother, aunt, sister, cousin, that's a pattern over more than one generation, and all of them have breast cancer, that would be a pattern. Ashkenazi Jewish ancestry. So people of Ashkenazi Jewish ancestry, because of the founder mutation effect, have an increased risk for having BRCA1 or BRCA2 mutations. Remember, the incidence we said was about 1 in 40. Having a relative with a known mutation in the family, that's a red flag. Any woman with triple negative breast cancer and male breast cancer is also a red flag. Male breast cancer is actually rare. Only about 2,600 men, according to the American Cancer Society, will be diagnosed with breast cancer this year. So let's say you have your client and you have determined that this person is appropriate for genetic testing or to be counseled about it, and they undergo genetic testing. What are the possible results that we can see? Well, because most cancer in the world is not an inherited problem, we get a lot of negative results. But the important thing there is that people need to understand a negative test result does not mean they will not get cancer. We all have a risk for cancer. Women at average risk need to start screening at age 40. We all need to be aware of our breast. We all need to have regular clinical exams. So a negative test, that's real important that people understand. That does not mean you will never get cancer. We do see positive results in about 10% of the time. So based on the gene mutation there is, the gene affected, then we talk about how that impacts the client. But then there's this other part here, about 40% of the time, where we have an inconclusive result. So what does that mean? Well, we call that a variant of unknown significance. And the easiest way to explain that to a client is this. Remember, I said genes are like a recipe in a cookbook. This means, hey, we found a change in the recipe, a variant, but we don't know if it messes up the cake or makes it better, because you can change recipes and make things better. So a variant of uncertain significance does not mean bad. It just means unknown. We don't know. So sometimes that can be a little bit more difficult for clients to accept or to understand, but if you just reassure them that this does not mean bad, it just means we don't know. And I can tell you about 90% of the time, these variants of uncertain significance get reclassified as not significant. So those are the possible results we can see. Now, how do you use the information? What do patients do with it? Many times when we're talking to clients, they might say, well, I know I'm at risk. Well, so what if I get the test? What does that mean? What am I going to do with it? Well, one is that it may provide options for surgery. In terms of people who are diagnosed with breast cancer, they may use that information to help plan their surgical treatment. It may also be used in their actual treatment after surgery. So, for example, PARP inhibitors. And of course, it can impact their cancer screenings. So let's talk about increased screening. For women who are at high risk for breast cancer based on a hereditary risk, we need to have them screened earlier and with not just mammogram, but with breast MRI. And so that would be an increased screening strategy for women at high risk. Now, panel testing, I mentioned earlier that typically we will do panel testing 35 genes, not just 2. And because we're doing panel testing, we have found other hereditary cancer syndromes in people, not just hereditary breast cancer, but there might be somebody that has Lynch syndrome, which is a hereditary colon cancer, or familial adenomatous polyposis, which is also a hereditary polyposis syndrome with an increased risk for colon cancer. And these syndromes may result in an increased risk for colon and the need for earlier screening and possibly preventive surgery. So they may need colonoscopies sooner than age 50. or excuse me, 45. As far as reducing risk for breast cancer, there may be medicines that women can take to reduce their risk for breast cancer if appropriate. So that's an option. And then preventive surgery. So obviously, if a woman is at very high risk for breast cancer, she may choose to have preventive or prophylactic mastectomies, and at the appropriate time, removal of their ovaries. But also, if somebody's at high risk, they need to reduce their risk with lifestyle. And so I always talk with clients about risk reduction with lifestyle. One of those is weight control. Be a healthy weight. Now, I am constantly trying to get to a healthy weight. I'm just not always been successful, but I keep trying. Eat a healthy diet, 5 or more servings of fruit and vegetables a day. Alcohol. So basically, the American Cancer Society recommends it's best not to drink. But for people who choose to drink, they should limit their consumption to no more than 1 drink per day. And exercise. Exercise has been shown to reduce the risk for cancer. And so it's recommended that people get 150 minutes of moderate intensity exercise a week. Now, moderate intensity is different per person, but basically what a person needs to do is to exercise at an intensity where they're a little out of breath, but they can still talk, and that's moderate. And you want to get 150 minutes a week. And if you divide 150 by 4, that's about 37 minutes, 4 days a week. And it's also important to remember, some people, it's like 37 minutes is too much at one time, and they just can't think about that. So it's also, if you do 3 10-minute walks, a 10-minute walk 3 times in a day is equivalent to 30 minutes. So some people can do 10, in their mind, they can do 10. So if they can do that 3 times in a day, they've done 30 minutes. So those are ways that you can help people incorporate exercise into their day-to-day routine. Now, I want to go over about genetic discrimination because there may still be some concerns that people have regarding genetic discrimination. So the Genetic Information Non-Discrimination Act states you can't use a person's genetic information or how they're made as a pre-existing condition or for terms of employment. So what that means is jobs are protected, health insurance is protected, okay? But the laws do not apply to things like life insurance, long-term care, and long-term disability. So you want to potentially, patients or clients may ask you about this, and it may be that they need to, if they're concerned about this, they may need to look into taking care of their life insurance before doing the test. The test results are like any other healthcare information. They're part of a protected medical record, and labs cannot use the identifiable data without the consent of the client. So let's talk about resources now. We have the breast cancer gene screen resource, and this is a screening tool that is recommended by the U.S. Preventative Services Task Force. It's online, and it asks questions about family history to assess for hereditary cancer risk and the possible benefit of additional information. So Georgia Corps' Gene Screen Project started in 2012 with Alice Kerber, and she has since retired, and I was fortunate enough to take this position for her so we can keep this program going. And it is to provide education to women and promote access to genetic services. So the genetic screening program is funded by a cooperative agreement with the Georgia Department of Public Health. The tool is designed to quickly identify who should be referred for cancer genetic counseling, to formally evaluate their family history, and discuss the benefits and limitations of genetic testing for hereditary cancer. It's available in English and Spanish, and there's a choice of being just, you can take this as part of the general public or a healthcare provider for a patient. And the direct link is here, www.breastcancergenescreen.org. So when you go into the tool, this is the landing page, and you click on Save Data if you want to be able to track it, so that we can track it. So if you're a healthcare provider, meaning at the health department, you want to save the data so that we get the data on the back end and we know how many people have taken the screen. When you complete the screen, then you will either see positive results or negative results. So the positive results mean that this client is appropriate to be referred for that cancer genetic education and counseling about genetic testing. And so you have these, and we recently updated these with my name, this is a client information sheet from Myriad Genetic Laboratories so that they can participate with the patient education program with Myriad Genetic Laboratories. And all they have to do, they can either, scan in the little QR code, or they can go to the site and they can look at the video and then call the certified genetic counselors there, and they can call them 7:30 a.m. to 8 p.m. Monday through Friday, and you can have the client talk with a genetic counselor about genetic testing. If they go through the process and complete the call, I am now the ordering provider, and then I will get a test request form from Myriad Genetic Laboratories. I can order the tests from there, and we can get those results for the patient. These client information sheets are both in English and in Spanish. So this is a real easy way for patients to get instruction and education about genetic testing. We encourage the step-by-step process there. Step 1, watch the video. Step 2, call the genetic counselor, and then finish the process, and I'll get the test request form and get the order going, okay? If this is a negative result, it's important that we encourage people to understand negative doesn't mean you will never get cancer. We want people to understand that everybody has a risk for cancer, and if you're at average risk, that's great. But you still want to have your regular cervical cancer screening, have your breast cancer screening as appropriate, have your breast exams as appropriate, and be aware of your breast. So that is all for today, and I thank you for your time and attention. And there is my contact information. So if you have any other questions, please feel free to give me a call. Thank you.